this is the story I want to go to. This is in Democracy Now, and this is about how Cuba has outdone us on vaccines and COVID, and this is despite the blockade, decades-long blockade that we have had on Cuba that has devastated their capacity to do any number of things and acquire any number of necessities. Cuba, despite that blockade, despite the embargo, has managed to pump out more doctors per capita than any other country in the world. A lot of those doctors travel the world to work with Doctors Without Borders, groups like this. Cuba also has developed a number of COVID vaccines despite that blockade and the U.S.'s best efforts to keep them from succeeding in these kinds of endeavors. And it looks like the global south is now basically turning to Cuba because they know that the United States and Europe are instead going to grovel to big pharma and try to maintain their monopoly over profits instead of trying to vaccinate the world. Just to give you guys a quick number, I don't know how up to date this is, but a couple of days ago, I saw that the entire continent of Africa is something like 7% vaccinated. So that's because we refuse to pass the TRIPS waiver. That's because we prioritize Pfizer and Moderna and Johnson & Johnson's profits over the well-being of human beings and over attempting to end a pandemic, okay? Again, this is in Democracy Now. Despite U.S. embargo, Cuba aims to share homegrown vaccine with Global South. A 60-year U.S. embargo that prevents U.S.-made products from being exported to Cuba has forced the small island nation to develop its own COVID-19 vaccines and rely on open-source designs for life-saving medical equipment such as ventilators. We speak to leading Cuban scientist Dr. Mitchell Valdez Sosa about how massive mobilization helped produce 3 original vaccines that have proven highly effective against the coronavirus. Quote, in a moment that the whole world was mobilizing to face this tremendous menace that was killing people around the world, the U.S. administration did not lift any of the 400 sanctions that were slapped on Cuba during the Trump administration, plus this decades-long embargo, said Valdez Sosa, director of the Cuban Center for Neuroscience. Medicines and vaccines are not a commodity. It's not something to get rich with. It's something to save people's lives. And then they go on to show the transcript of that conversation. I just wanted to make sure you guys had the details here. So this is the country that we villainize, you guys. And I'm not here to fucking simp for the Cuban government. Again, I'll give the caveat when we're talking about international issues. We are constantly the bad guy. That does not mean anyone else is inherently a good guy, okay? But Cuba on medical issues, certainly one of the world leaders. That, like, as I mentioned earlier, they lead the world in doctors per capita. It also means their education system's got to be pretty fucking excellent, doesn't it? And yet in the United States, the sort of picture that you get when Cuba is brought up is one of despair, one of struggle, and that socialism is bad and all this, these CIA talking points. So Cuba now basically showing the United States how to actually respond to a pandemic by attempting to provide treatment options and vaccination options to the rest of the world, trying to use your medical expertise to help the rest of the world. And by the way, Cuba is also engaging not just in sending vaccines directly, like producing and sending vaccines around the world. They're also looking to provide equipment and expertise to other countries to produce the vaccines around the world, which is what we refuse to do with the TRIPS waiver. So they're really trying to get this stuff out as quick as possible and provide the world with the options of vaccination as quickly as possible. One other thing I wanted to mention about this, you guys, they are like 93%. 93% of the Cuban population is at least partially vaccinated. Now, why might that be the case compared to the United States? Well, first of all, the trust in institutions is probably a lot higher in a country that has not, groveled to those institutions for decades. In the United States, there's no reason to trust big pharma. There's no real reason to trust the FDA or the CDC. And that's because of the powerful, the rotating door corruption and all this stuff, right? There's no reason to trust them. In Cuba, that's a little bit different. So there's probably less institutional distrust down there that would lead to the vaccine hesitancy. They also have universal health care. And we know that the most trusted person for most people when it comes to medical advice is their personal doctor. So in Cuba, they actually have access to their personal doctor, whereas in the United States, for a very significant portion of this country, that is a serious problem. So why might people be turning to a Facebook friend for medical information? Because they don't have access to a fucking doctor, because our healthcare system is dystopian. So there are a number of reasons why Cuba has such a high vaccination rate. It's also just easier to vaccinate people quicker when you have a centralized healthcare system. So there are a number of reasons here, you guys, that Cuba has shown us that their healthcare system, their education system, and their decision making surrounding public health crises is significantly superior to the United States. So I wanted to bring that story to you all. And it seems like in the US, we have this mentality of like, well, we're always doing the best we can. No, we're not. Cuba just showed us that despite this embargo, for decades long embargo and hundreds of sanctions, despite it, they were still able to produce a number of successful vaccines. And they're actually trying to help the rest of the world with those vaccines. Okay. Now, as I've said with COVID stuff in the past, you guys, I hate how inflammatory all of the rhetoric around a public health issue has gotten. I support any and all forms. I support early treatment options. I support anything that makes it less likely that people are going to spread this stuff, get this stuff, die from this stuff. Anything that can help on any of those steps, I'm in favor of. Please mask up, please distance, please take it seriously, please treat your community with the respect that you would want to be treated with if you had comorbidities or if you were living with someone who had comorbidities. Take it seriously, get yourself vaccinated if you're not vaccinated, support the early treatment options, pressure governments to go with the TRIPS waiver and get vaccines all around the world. We need to take every step we can to get rid of a pandemic that has just been absolutely devastating to the entire world. So good on Cuba, shame on the US, shame on Pfizer and Moderna, and our propensity to grovel towards big pharma instead of trying to vaccinate the world.